So talking about Bado's classification of Monteggia fracture. Monteggia fracture is the fracture of proximal 1/3 of ulna with the radial head dislocation, and it is divided into 1, 2, 3, 4 type according to Bado's. And in type 1 type of Bado's classification, it is most common type, and there is anterior dislocation of head of the radius with the fracture of the ulnar diaphysis, and there is anterior angulation of the fracture ulna. And in type 2 there is posterior dislocation of the radial head with the posteriorly angulated fracture of ulna. Again fracture of ulna is diaphyseal. There is posterior dislocation of radial head and posteriorly angulated fracture in type 2. And in type 3 there is lateral or anterolateral dislocation of radial head with the fracture of ulna, and ulna fracture is the metaphyseal type. And in the lateral or anterolateral dislocation of radial head with the fracture of ulna metaphysis. And in type 4 there is anterior dislocation of radial head. Again, like in type 1, there is again anterior dislocation of radial head, but it is with fracture of both radius and ulna at the same level. So in basically the difference between type 1 and type 4 is that in type 1 there is no radius fracture, there is only radial head dislocation, but here in type 4 there is anterior dislocation of radial head as well as fracture of both radius and ulna. So thank you. That was all about Bado's classification of Monteggia fracture.